community and you don't test, you don't know, a lot of people are going to get sick. And because of the incubation period, meaning that the time as which when you were exposed and to the time that you actually get sick is about 14 days. That's why we put people on quarantine for 14 days. That's what it means. And so there's a lag time where you may not have any symptoms, but it seems like at this particular point we already know that most people get some symptom by 5 days. And you've also heard that the people who are most at risk of dying, of being seriously sick, are the older folks. Okay. People over the age of 60, and then particularly with any chronic condition, number one, heart disease, diabetes, chronic lung disease, obstructive lung disease, cancers, people on immunodeficiency disease, if you're on chemotherapy, the risk of mortality is actually the highest of all the group. Okay, so if you just want to look at the news a little bit, this virus spread from person to person. Okay, and this happened with close exposure to a person who was infected, and all of what happened is the patient has to just cough, and the droplet that comes out of this cough is sneeze from an infected person, just like the flu. Okay, but this one obviously seems to be even faster. Is that this droplet can land or hanging around there just enough so people who are close enough can breathe this stuff, or it can fall on your mouth, your nose, your eyes. And we know that not only the virus can be in your hand after you shake somebody's hand, but if you put your hand in your face, you can actually make yourself sick. Okay, and if you don't know anything about the spread of the virus or the danger of the virus, look at the rapid evolutions of this virus around the world in less than 3 months. Okay, as of today, from what I heard, the World Health Organization finally admit that this is officially a pandemic because over 120 countries have been involved. Over 5,000 people die. Over 110,000 people actually have been identified and sick. Here in the United States, within 2 weeks, we go from 15 cases to now, we are over 500 cases as of yesterday, 22 deaths, over 34 states, and this thing is going from person to person just like wildfire. And the reason the number is still low is because we haven't been testing everybody who needs to be tested. Okay, so the good news is I've talked to some of my folks, my colleagues in the community at the health department and private practice. We have some of the test kit right here in town, and they actually testing. The primary care physician may not be testing in the office. They would refer everybody to the health department. Okay, because most office may not be necessarily equipped, because you cannot bring somebody in the office that is at risk that may infect a lot of folks. So the viruses are there, and I don't have to talk to you about the financial market, the world collapse, and the way our lives have been changing already. Okay, so to summarize, all right, testing is extremely important, especially if you have symptoms. Okay, unless you know for sure that you have the flu or you have a cold and you don't run a fever. But if you're still sick and you have those symptoms, and God forbid, if you obviously had some risk of exposure, you have to be tested. And if you had exposure and you were involved with a lot of people, you were in a crowd, everybody in that crowd need to be tested as well. Okay? So we're going to take a short break here, and then we'll come back quickly with some good news and exactly what you need to do as an individual to protect yourself. We'll be right back.
This is Cara Festo Radio. 99 Gems, The Berg. This is Cara Festo Radio. 99 Gems, The Berg.
This is Dr. Morency, 99.1 FM. You listen to the Doctors in the House. Tonight we're talking about the COVID-19 virus. And we're talking about a really relevant case to you for folks who have symptoms and they're not sure what to do. So, my friend here had a question for me here.
Yes, sir, Dr. Morency, this is Star. I just wanted to say as well, along with the possibilities, now trying to find out, as someone who just wants to know, but I'm sure there's listeners out there who want to know as well, where would I just go to a clinic, or I'm sure some people would even actually be concerned as to not give themselves that label too quickly or prematurely.
Well, this is an extremely important question. That's what I've been talking about in terms of the testing, how important it is. At this point, if you really don't have any symptoms, you'd have no risk of exposure. If they ask you this question, you may not get the test, but the test is in town. If you live here in Pinellas County, Hillsborough County, we have the test in the health department. The test is probably not at the doctor's office right now. They will refer you to the health department to be tested. So you can test your local health department. I have some numbers here at the end I can give you. If you have symptoms and that include fever, flu type thing, you want to be tested, you should call. Okay, whether or not they screen you or not before you hand, that's a different story.
And one more thing, because I know around this time of the year, a lot of people are catching the flu. Should we be going there as well? That I'm sure there's some who are wanting.
Well, this is the point of my talk tonight. I wanted to really, for those people who cannot afford to go to the doctor for many reasons, or not sick enough, the difference between the flu and the cold and the common seasonal allergy. The key is fever, okay? Fever and exposure. Those are the things you have to remember. If you have a fever greater than 100.4, and then you have symptom of the flu, and then there's flu going around, maybe, you have the flu, okay? You can run your course like that. Now, if you know you've had any risk at all, if you have any doubt that you may have some risk, then you want to have the test done for the virus. Then you call the health department, say you're sick, you have a fever, you need to be tested. Okay, so yeah.
One last thing, Dr. Morency. Now, I'm sure there's some people out there who will be very laid back and don't think that they have anything, and there's some people who will assume that they have something. I work in a place where there's lots of people coming in, commuting, and I hear sniffles and coughs all the time. I could assume that I might have exposure.
Well, again, the reason I give this show is the fact that if we are in denial, there seems like a big segment of our government may have been in denial. In other words, this is going to be passing by. The news, I've been telling you, there are a lot of people who've been on the news, expert, infectious disease specialists, public health specialists, people from CDC, who I tell you, this is very dangerous. And the reason it's so dangerous because it can spread so fast, so easily, okay? And the reason we don't have such a bigger number is because we haven't been testing a lot of people. So now it's drip, we find the thing. So for the time that I have remaining, okay, let me give you some good news first. The good news is the majority of people in good health really will not die. By the time I mean probably, there's always exception. The people at the most highest risk are the older folks over 60 and above who have chronic disease. And those are the people who've been in the hospital who actually been dead. If you look at some of the cases in Florida, everybody's over 60 years old, okay, who've been infected, and there are obviously 2 cases of death in Florida, okay? So as a young person, you're in your 20s and 30s, this may feel like, you may not even know you're sick, okay? It may feel like a cold or a flu, and because you don't bear the brunt of the symptoms. So over 80% of people recover. Around the world, there are about 60,000 people among all those people who've been infected, especially with our experience in China, who actually get discharged from the hospital. So now it's more even concrete. From all the experts are coming out and said, the folks who are at risk, those are the ones that we have to protect ourselves, or we have to protect them as well, because you as an individual, if you get the virus and you're not sick, you can pass this on to your parents, your grandparents, or people who actually have diabetes. There's a lot of people with diabetes in the community, okay? So that's why you have to take care of yourself. Make sure that you're safe. It's not just for you, it's for your community, okay? My recommendation is, I'm glad that the tests are finally coming in your area, okay? But that's been the downfall for SNO, because an infectious disease like this, which is so dangerous in terms of spread, people need to know where they stand, okay? So that's the good news. So only about 15% of people will sick and get hospitalized, and a lot of those people actually been discharged. Okay, so again, the people who are in trouble, the people at highest risk of disease, of being very sick and dying, and actually the fact shows it, the folks with chronic disease, the older you get, the more at risk you have as far as mortality is concerned. Okay? And the reason I cannot give you a mortality number because we need to know the bottom line. We need to know how many people are involved, then we compare. But for now, the World Health Organization is about, on the average, 2 to 3.4% of all people who get sick, may actually die. And it turns out the bulk of those people are people older with chronic disease. In China, with the 138 people who are in hospital, that's what really they find out. Okay, so the bottom line is the virus is going to do whatever it does. It's us who have to protect ourselves. Just using safe, tested public health measures for prevention, which the CDC outlined very nicely in their thing, can save your life. Okay, so you gotta wake up. This is real. I mean, I don't have to tell you. All you have to do, you already seen this. I'm not repeating what's on TV. I'm telling you how to deal with yourself as an individual basis. Okay, so what do you do really? Well, we've done that with the flu virus every year. Ask people, wash your hand. As a matter of fact, I remember clearly during the swine flu virus, we talk about this, even professional, we talk about this, we talk about it. Do not shake hand, do the fist bump. Me now, what I do is I bow like the Japanese does, okay? I don't have to make physical contact with you because the closer you are to somebody, especially with the virus, the more likely you need to contract it, especially this particular virus. I'm not alarming you, but if you stay away, it's not going to come to you, okay? So just to protect yourself, wash your hand with soap and water, 20 seconds, okay? And then if you don't have that, you can use one of those hand sanitizers that at least contains 60% of alcohol, okay? And you cannot not overwash your hand. The other thing is don't touch your face because the virus get access to you, to your mucous membrane, to your eyes, to your nose, to your throat, to your mouth, okay? So, but we put our hand on our face all the time. And every time we tell people not to put their face, and if you watch them long enough, they put their hand in their face, okay? And again, don't shake hands, okay? And with this virus, because the virus can stay in certain surface for a while, then you can use, sterilizers to really clean those surfaces, okay? Generally, light switch, doorknob, cabinet handle, your stairs, and places like this. Those, the virus can, it's kind of fuzzy now how long the virus can survive. It goes from 2 hours to, some people said 9 days. I don't know about 9 days on a surface. Okay, so that means that when you touch a surface, you have no idea what's in there. The virus could be there because obviously you're not gonna, see that. Okay, so this is very important. So those prevention work, and then you do all the other stuff that you do when you're sick. Okay, you gotta get good sleep, plenty of fluid, take some anti-inflammatory drug to take care of your aches and pain and your fever, and those are been true and tested measures. Don't believe those things. This is what experts are saying. Okay, and if you're sick, stay home. I know it's going to be all kind of financial situation involved with this for a lot of people who don't have means, but by going out there and in crowd and in concerts and in football games and stuff like that, you don't know who's sick. So the more you stay at home, if you don't have to go out there and do something. But for my older folks, like myself, you're at risk. And according to the CDC yesterday, that's a little piece of not so good news. The virus is going to hang around. It's not going to disappear because it gets warmer. It's going to hang around for the rest of the year and even next year. So we older folks who are, over 60s, we are at risk. So if you need to stock on some dry food and stuff like that, do so that you prevent yourself from going out there. Because if you isolate it in your room, you're not gonna get the virus. The virus are gonna come and attack you. You have to be exposed. Person-to-person transmission. All right. So there are some very quick questions people ask about the high risk. We talk about the high risk. What about the test? Well, this test has been late in coming, but it's here. It's now. I think for me personally, in my local area, Tampa Bay area, the test is available, and they have allowed some of the commercial companies such as LabCorp, and to actually do the test themselves. And everybody who's sick need to be tested. They should be tested. That's how we know. Okay. If the test is initially negative, it may mean that you don't have, you may not be symptomatic enough to be positive. You can be retested again later on. But after 14 days, if you don't really get sick, you're safe. Okay, so that's part of the good news. And kids, remarkably, few children get sick, but they're not necessarily much as risk for getting sick, but they can still have the germ and carry the germ. Can be carriers, okay? So because of time constraint, I am going to stop right now. And if you have any questions, please, give us a call. Because it's very important for you to be on top of it as an individual and not wait. I want you to be proactive. Okay, phone number is 727-637-2416. Thank you very much. This is an ongoing talk. This is evolving. So we may bring the subject again or have a follow-up next time. All right? Thank you for listening.
This is Cara Festo Radio. 99 Gems, The Berg.
Bonsoir. Zach Passé, Tampa Bay. Welcome to the sounds of Haiti, 99.1 FM, WUJM, St Petersburg, Florida, your community radio. We have a great selection of music for you tonight. Please stand by. Please stand by.